Hello and welcome to the topic Approach to a Patient with Gastrointestinal Bleeding in the Surgical module. By the end of this session, you should be able to define gastrointestinal bleeding, explain the pathophysiology of gastrointestinal bleeding, identify causes of gastrointestinal bleeding, outline the clinical manifestations of gastrointestinal bleeding, list the investigations done for diagnosing gastrointestinal bleeding, and finally, discuss the management of gastrointestinal bleeding. Moving forward, we will be using the term GI bleed to represent gastrointestinal bleeding. Let's get started. So, what is gastrointestinal bleeding? GI bleed, also called gastrointestinal hemorrhage, is all forms of bleeding in the gastrointestinal tract from the mouth to the rectum. When there is significant blood loss over a short time, symptoms may include hematemesis, which is vomiting fresh blood, coffee ground vomitus, hematochezia, which is passing fresh blood per rectum, and melena. GI bleed can be largely classified into upper and lower GI bleed. Upper GI bleed site of hemorrhage is proximal to the ligament of Treitz, whereas lower GI bleed site of hemorrhage is distal to the ligament of Treitz. Let's look at the causes of upper GI and lower GI bleed. Peptic ulcers are the common cause of GI bleeding. These ulcers are open sores that develop in the lining of the stomach or duodenum. An infection from the H. pylori bacteria usually causes peptic ulcers. Also, esophageal varices that bleed can cause upper GI bleed as well. Tears in the walls of the esophagus can also cause GI bleeding, and this condition is known as Mallory-Weiss syndrome. Now, let's take a look at the causes of lower GI bleeding. One of the most common causes of lower GI bleeding is colitis, which occurs when the internal layer of the colon becomes inflamed due to many reasons, such as infection, inflammation, food poisoning, or parasitic infections, and sometimes ischemia as well. Another possibility of lower GI bleed not to miss is malignancy. So, what is the pathophysiology of upper gastrointestinal bleed? How does this happen? So, peptic ulcer disease, as we know, are one of the common causes of upper GI bleeding and usually caused by Helicobacter pylori infection, causing an ulcer which then burrows deeper into the gastroduodenal mucosa. This then leads to weakening and necrosis of the arterial wall, which continues to the formation of a pseudoaneurysm. The weakened arterial wall rupture, and this leads to hemorrhage causing upper GI bleed. As for lower GI bleed, the causes include an anatomic, which is diverticulosis, vascular, which is angiodysplasia, ischemia or radiation induced, inflammatory causes such as inflammatory bowel diseases, infectious causes, and neoplasms. This leads to a rupture or break of the vessel wall, depending on what the causes are. And this then leads to bleeding into the gut lumen, which then leads to evidence of rectal bleeding or lower gastrointestinal bleed. If one experiences any one of these symptoms, such as pallor, weakness, having breathlessness, or dizziness, then these are evidences of anemia. These symptoms may also signal severe bleeding if not attended immediately. So, what are the specific features of gastrointestinal bleeding? Of course, there has to be an evidence of gastrointestinal bleeding. There are such as hematemesis, which is a condition where the patient vomits blood, which may be red or coffee ground in appearance, most commonly due to bleeding in the upper gastrointestinal tract, which could be due to esophageal or stomach erosion. Melena, a black tarry stool appearance with strong offensive odor, most commonly due to bleeding in the upper gastrointestinal tract, or also can be bleeding from the small bowel or the right colon. Hematochezia, the passage of bright red or fresh blood through the anus with or without the stool accompanying, most commonly due to bleeding in the lower gastrointestinal tract. Colonic bleeding represent a maroon jelly-like traces of blood in the stool, and if it's just rectal bleeding, one would expect to see streaks of fresh blood on stools, and finally not missing the signs of anemia. Let's take a look at lab tests. So lab tests are done to help diagnose the cause of GI bleeding, which include liver function tests, platelet counts, coagulation profile, and these all come under the category of blood tests. Next would be a stool test. So this is done to identify occult bleeding. And lastly, nasogastric lavage. So here a tube is passed through the nose into the stomach to remove stomach contents, and this might help determine the source of the bleeding, but is not commonly done. However, we would leave in a nasogastric tube which has a free flow to collect the gastrointestinal contents that's coming from the upper GI tract. Let's look at the next part, which is imaging studies. This is done to help find the cause of the GI bleed. So example would include abdominal CT scans. An abdominal CT can use a combination of X-rays and computer technology to create images of the GI tract. Here we will be able to see if there's any evidence of intra-abdominal bleeding due to the enhancements of the contrast. Next, we can do some other structural and functional tests as well, which include lower GI and upper GI series. Now, this looks at large intestines and also the upper GI tract using the aid of barium as well as fluoroscopy. An angiogram is a special kind of X-ray in which a radiologist threads a catheter through the large arteries. Here, they perform the procedure and interpret the images. And here you may also be able to see if there's any evidence of bleeding because it's very specific to the vessel. And finally, a radionuclide scan to also find the cause and the area of bleeding, which is not regularly done. So the common investigations that are carried out, not forgettingly, would be an endoscopy. Let's quickly take a look at the management of gastrointestinal bleeding. In many cases, medication or a procedure to control the bleeding can be given during some tests. So, for example, it's sometimes possible to treat a bleeding peptic ulcer during an upper endoscopy or to remove polyps during a colonoscopy. Often GI bleeding stops on its own, but if it doesn't, treatment depends on where the bleed is coming from. In many cases, medication or a procedure to control the bleeding can be given during some tests. If one has an upper GI bleed, then an intravenous drug called proton pump inhibitor is given to suppress stomach acid production. So once the source of the bleeding is identified, then the doctor can determine whether or not to continue the proton pump inhibitor. Depending on the amount of blood loss, whether one continues to bleed, one may then require large bore IV cannulas for fluid as well as blood transfusion. If the patient is on blood thinning medications such as aspirin or anticoagulant therapy, then that has to be stopped. So, what are the medications that can be given for gastrointestinal bleeding? Apart from proton pump inhibitor, if a peptic ulcer disease is identified and confirmed secondary to Helicobacter pylori infection, then antibiotics therapy can be given. This is known as the triple therapy. Among the operative procedures that can be carried out during an endoscopy include injection of a vasoconstrictive agents towards the area of bleed, injection of sclerosing agents if it's a likelihood of a variceal bleed, bipolar electrocoagulation, laser photocoagulation, and many more. So, if none of the other tests help us diagnose the source of bleeding, then the surgeon may actually perform a laparotomy. So, during a laparotomy, a surgeon will make a single cut in the abdomen and explore the abdomen. During the surgery, the surgeon can treat the problems that cause the bleeding. For this procedure, the patient will be given general anesthesia. Emergency surgery in upper GI bleed typically entails oversewing the bleeding vessel in the stomach or duodenum, vagotomy with pyloroplasty, or partial gastrectomy. Let's recap. Gastrointestinal bleeding can be divided into two, which is upper and lower gastrointestinal bleeding. In upper gastrointestinal bleed, the site of bleeding is proximal to the ligament of Treitz. However, in lower gastrointestinal bleed, the site of bleeding is distal to the ligament of Treitz. First, one should identify the signs and symptoms of gastrointestinal bleeding, as this tells us the possible site of bleeding as well as the severity or extent of bleed. Management begins with initial resuscitation and establishing hemostasis. And this can be done via endoscopy or laparotomy if the source of bleeding cannot be attained through endoscopy. Alright, so we have come to the end of this topic. Thank you for your time.